While Australians have been celebrating Easter this weekend, a small charity based in Perth, Western Australia, Living Child, is busy responding to the biggest floods experienced for decades in the Sepik region of Papua New Guinea, made worse by a massive earthquake which hit the Middle Sepik last Sunday. This region is referred to as the Second Amazon due to its remote nature and lack of infrastructure, which present significant barriers to travel. There are no roads or telecommunication across most of the area. Stories and local reports of damage, death and illness have been slow to come through. We have heard directly from our care group's community development project coordinators John and Gina Tarrant from Yaman village, about 8 hours powerboat ride away from Angoram on the banks of the lower Sepik. The water has been high in the Kerem River area for over 4 weeks now, says John, destroying cocoa plantations, food gardens, washing away rainwater tanks and pit toilets. There is no clean drinking water and many people are suffering with diarrhoea now. Yesterday, a young child died from diarrhoea. Gina said they are washing, drinking and toileting in the water. Many people are suffering from malaria as well. 3 children have drowned in the floods from my village, said Maki Bowden. Another young girl and a woman drowned when their house collapsed during the earthquake. And on Friday night, a man died from diarrhoea. We need prayers as there are many people suffering. Living Child have received reports of 39 deaths, mostly elderly and children. There is no dry ground to bury the dead. Cholera is evident in the villages, but testing kits are not available. One staff member reported over 500 cases of malaria in one village, with no anti-malarial available for treatment. The villagers are desperate for mobile health clinics to distribute medicines, food, care packages and filtration buckets. At the invitation of East Sepik Provincial Health Authority, Living Child have mobilised an experienced disaster relief nurse midwife, Mr. Christian Wright, to support the emergency relief efforts in the region. Sarah David said, "Women do not stop having babies during a natural disaster. It is imperative that they have access to clean water and clean birth and menstruation kits.